My name is Annalise Poets. I'm the KT manager for Kids Brain Health Network, a federally funded network of centers of excellence. So, I want to tell you a little bit about Kids Brain Health Network first. These cute little kids are actually my friend Trish's kids. It's William and Anna. William actually was diagnosed on the autism spectrum. He's got Asperger's, and I got permission from Trish to use this picture of her kids in my presentation. And I wanted to show this to you because it was actually coincidental that I started to work for Kids Brain Health Network at the same time that her child was diagnosed with autism. Because Kids Brain Health Network focuses on early diagnosis and treatment of autism spectrum disorders, fetal alcohol spectrum disorders, and cerebral palsy. And what we really want to do is make a difference for families in terms of their quality of life. And so we do this by trying to help inform policies and services and practices with the research that we do. So having a friend who has a child on the spectrum really sort of brings another dimension to my work where I really understand some of the issues that are facing parents and also children. So I want you to think about the last purchase that you made. It could be small, it could be just a cup of coffee or lunch, it could have been something big, maybe an iPhone. And think about why you bought that. What need did that fulfill? Or did you just want it for some reason? Or even think even more simply about the break that we just had, and why did you choose the things that you chose to drink and eat, or why did you choose to maybe use the washroom instead of using your time to eat? What value did that create for you? What I realized a couple of years ago, actually it was about 5 years ago when I lived in Winnipeg and I was working in knowledge translation there. I didn't have any friends there, so I would every Saturday morning take a book and go across the street to the Starbucks. And actually, after 2 years of working in Winnipeg, I only got 15 pages into the same book. So I didn't actually read. It was because I ended up talking to people. And this one guy that I met, Glenn, he was asking, so what do you do? And I was telling him what I did, and stakeholder consultation, and we figure out what people's needs are, and then we respond to their needs with evidence-informed products and processes and things like that. And he's smiling, and I said, what? And he goes, well, you're pretty much a business analyst. I'm a business analyst, and that's what we do. And so I was like, oh, actually, you're not the first person who has said this to me. So then I started to look into the field of business analysis, and I started to take courses, and I realized he was right. And so what I want to talk to you today about is about how I've applied the concepts and the framework in the field of business analysis to my work in knowledge translation. So this is the business analysis framework that I'm talking about. There are 6 core concepts. And what I want you to remember about this is that they are all of equal importance, and they all inform and define each other. You can't, if you leave one of these things out, it's going to be a disaster and it's not going to work. And in other presentations, I talk about some of the mistakes that I've made, and I've learned that actually, that one of the mistakes I talk about is where I left out the consideration of context, and it didn't work. So, I'm going to talk to you about these 6 elements in a little bit more detail in the context of an environmental scan that we did. So, our network came to us and said, okay, we need to understand the needs of the stakeholders so that we make sure that our work is relevant and that it will create value and impact for people. And the way that you create value is you create stuff that they need, right? Remember when I asked you about why did you purchase your last purchase, or why did you choose what you just ate? Because you wanted it or you needed it. There was that pull. And in KT, we talk about the push-pull. Well, that's what the pull is, as you know. So by finding out what stakeholder needs are, we create value for them, see how the needs are related to value. We know what changes we need to recommend are made in policies and practices, and also consideration of context. And we find all this stuff out from stakeholders. So in terms of value, what I mentioned was that it has to be something that you want or need. So in the environmental scan, what I did was I interviewed 32 people who were parents of children with a neurodevelopmental condition, so cerebral palsy, FASD, or ASD. Also the clinicians, so the clinicians who work with families, and I asked them, what, in your perspective, what are the needs that you see that they need, and then as a clinician, what do you need? And then the same thing with policymakers. What have you guys heard from your consultations that you've done as a government or other type of, maybe a policymaker in a program? What have you heard are the needs? And then what do you need as a policymaker? And so I framed it also as what are your needs and challenges. So, parents are the ones who are the recipients of the services that are dictated by the policies. So they're the best people to ask about what's working and what's not. So I learned a lot from these folks about their experiences and what were their challenges. And we actually came up with a list of 44 needs. And I won't get into a lot of the methodology. I talked about that in other presentations, and you can also feel free to call me anytime again. I love to talk about this stuff, so I'll talk to you in detail about it if you want. But we came up with a list of 44 needs. So, and the only way you can get at that, as I mentioned, is to ask the stakeholders. So these were the stakeholders that I asked. You have to figure out, when you're figuring out what stakeholders to ask, you have to think just common sense. Who are the people who are affected by, what are we trying to do, and then what do we want to know, and who are the stakeholders that are affected by it? And so we landed on parents, clinicians, and policymakers. And what I learned throughout the process is that we first started with clinician researchers in our network, and then I realized, actually we should probably ask clinicians outside our network. So we got an amendment. That was the first amendment to the ethics approval. And then I realized, actually when I'm contacting the provincial governments, I started at the top, and by the time I got a response from someone, it had been emailed about 10 times to other people. You could see the list. And sometimes it wasn't actually a policymaker, it was a frontline worker. So it wasn't actually a clinician researcher, it was a frontline worker, but I still wanted to interview them. So then I had to get another amendment. So I got actually 4 amendments in total. But it was okay because it was a sort of a learning as you go thing. But stakeholders are the experts, and they're the ones that know what their needs are, and they can best inform you on what are the changes that are needed and stuff like that. And actually what I did was I used grounded theory methodology, and within the methodology is built in this sort of stakeholder engagement where I came up with a list of 44 needs that I heard them say, but then I went back to them and said, do I have it right? And they got back to me, gave me detail, and explained further on some of the more nuances about that I should explain. One of the nuances, I can give you an example, is that housing was an issue. Housing for youth with neurodevelopmental conditions to be able to go and live on their own. And I had put to be able to live independently, and someone corrected me and said, okay, there's different levels of independence, so I would change that to say that they can live as independently as possible, because some people need more support than others. So that was really informative. So stakeholders are golden. You really need to ask them. So remember I showed you the diagram and everything was connected, and I said that everything defines the other stuff. So I was a little sneaky, and in my questions when I was interviewing people, I asked them about what they thought were the solutions. And I also I asked them directly about solutions, but then I also asked them sort of indirectly by using the magic wand question that all qualitative researchers like to do at the end. If you had a magic wand and had unlimited resources and unlimited time, what would you do? And that was my way of not only sort of getting their ideas of what their solutions were, but what I was really getting at is what are the needs underlying those solutions. So when somebody starts telling me, well, I would build a community, for all the youth with neurodevelopmental conditions so that they can live, and it would be safe and there would be support and whatever. Well, that tells me a lot about what the needs are. Their need for safety, their need for support, their need for housing, all of that stuff, right? And then there were different contexts. So really, for those of you who are familiar with grounded theory, you'll know this already, but for those of you who aren't, basically you kind of throw it open and ask really open-ended questions and learn and listen from people. And so what I was also listening for were what are the different contexts in which they have these challenges and these needs. And so what came out was actually the school system was a really, really strong context that people found the needs in, like need for specialized training of teachers, because kids spend most of their day there. And if they have a bad experience in school because they're frustrated because they're being expected to do stuff in a way that they can't do because of their disability, then they're going to come home stressed and anxious, and that just creates more problems. And so and that's only one example of the education system, but that was very, very strong. People talked about that a lot. And of course, in the hospital, I don't know if there's any people from Trek here. Are there any Trek people? Yes. All right. So what came out, people were talking about the difficulties that they had going to the hospital with their child that has a neurodevelopmental condition, particularly FASD and ASD, because there's sensory input issues. And so you've got a kid who's very sensitive to smells and sounds and all this stuff, and you're sitting there in the ER, and that's what characterizes the ER. And so it's very difficult to have to sit there and wait, and then the child has behavioral outcomes because they're trying to regulate themselves and they can't, and just because of the environment. And so what we did was called up the wonderful people at Trek, and we now have a collaboration where we're actually developing in partnership a bottom line recommendation. They already have the process, and they have the committees of ER doctors and everything. And it just started with a phone call from this and said, hey, the parents are saying they need this. Do you guys want to collaborate and create a bottom line recommendation so that ER physicians actually have something to a guideline and processes, and also it's for administrative people too. And so we're working on that, and it's really cool. It's really progressing. So that's going to have a direct impact on care. And then, of course, the home environment was seen as the most safe place, and but also characteristics of the home environment that maybe weren't as positive were extended family and judgment on, parents were saying, oh God, my in-laws are telling me how to parent my kid, and they're saying he's got behavioral issues, and he's got autism, and I'm trying to tell him he can't do what you're asking him to do. And so stuff like that, the little nuances of family life. And of course, we're in the broader context of Canada, so there's different levels of context that you want to consider as well. And finally, what about changes that are needed? So there's policy changes, there's practice changes, there's also individual behavior changes. So for example, one of our projects is social ABCs, and they actually teach parents how to interact with their kids to, even when their kid doesn't have a diagnosis, but they're suspected of having autism. And so they teach parents how to interact with them in a way that will facilitate their language development and sort of develop them in a way that'll set them on the right trajectory. And so that's an example of individual change. And there's changes in legislation as well. So there was a family who went to the Supreme Court. This was in Newfoundland. And now in that province, it's actually legislated that they have to provide ABA, which is an intervention for autism. And so they have to provide that with no wait time. And then, but it's funny because we also triangulated our findings with data from government reports, and so they actually did a consultation in that province. And when I was reading that report, I learned that actually that's not actually even working because they can't find qualified people to deliver the interventions. So there's no wait list, but then you can't find anybody qualified either. So, but this is the kind of nuanced stuff you can get at when you talk to stakeholders. And then, of course, so I talked about parents interacting with their children, and then also it impacts changes in terms of services and how services are provided to people. So a lot of people mentioned that there needs to be this in-depth specialized training for family physicians, general practitioners, to be able to identify the signs of a child that may have autism or FASD or cerebral palsy, to be able to refer them to the appropriate specialist. Because what the parents were telling me is that, gosh, I was telling our family physician that I noticed these signs and I suspected autism, and I even have an older child on the spectrum, and I was, which increases the risk, and I was trying to tell them, and they said, oh no, it's just you just have a bright kid, and whatever, and that delayed the diagnosis by several years, and those years could have been used for intervention and for making a difference in child. So that was another thing that came out. So anyways, that's it. Thank you.